Yeah, how are you doing?
Alright, I guess.
So, when you went to see Dr. Montanet, did she have any symptoms in
She-
terms of her, before
Yes,
the change
I
in the
told
appearance?
Dr. Montanay when we seen her because when Hannah was discharged from the hospital, she was still doing the movements, the twitching and everything. She was very sweaty and she wasn't baseline to where I know of her. So that tells me she's still sick, you know. So I made the follow-up appointment with Dr. Montanay. I explained to her how I felt. I explained to her, you know, what she was in for and everything. And she goes, okay, well, let me get a hold of infectious disease doctors and, you know, put her input and then, you know, you guys together and then come up with something. So she did the urine culture when we were there, and it came back positive for pseudomonas.
The, was the urine changing its appearance?
What do you mean?
Did the urine, was it like...
It was, her pee was strong. I noticed her pee, I was explaining to her, when I know she's sick, she has the signs of like the smelly urine, and she does like the twitching of the face expressions and the movements here. When she's baseline and not sick, she connects with me, she smiles with me, you know what I mean? Lately, it hasn't been that way. So that's telling me, as her mother, that's been taking care of her for 12 years, Mom, I'm sick, I need help. So this is why we're here, and I take her to all these specialists and everything, and this poor child still continues to have, you know, these crazy infections. And it's very frustrating as her parent when she has other, you know, medical issues that need to be addressed, and I can't even address them because the poor kid can't recover without relapsing and getting sick again.
Okay. So, did she have any change in her respiratory secretions?
She does. They're very thick and yellow and green, yes.
Are they now better or not?
No, they're the same.
Okay. And, is she coughing?
She coughs when they use that machine on her. The coughalator there, right there.
Okay.
That's what helps her.
And the
I use that
pulmonologist,
to
Dr. Weatherly, saw her when you came in. Has he seen her again?
No, just one time.
Okay, and what did he recommend?
The higher dose of the saline.
Okay, did that help?
No.
Okay. And, so the issue of the twitching you say? When do you notice that?
When she's sick. That's a sign of her telling me that she's sick.
But that could be any type of sickness?
It could be any kind of sickness.
Okay.
And that tells me, Mom, I'm sick. You know, I need to go see a doctor, and this is what I do.
Okay.
When she's baseline, she doesn't do that. She smiles. She's a very happy child. For someone who's so medically complex, she's the happiest kid I ever seen in my life, you know. She has a beautiful smile. She smiles at me. But when she's sick, and I know. You know, I know my kid the best, you know. And it's frustrating because, I mean, she just keeps getting these recurrent infections. It's not just one time, it's boom, 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 and it's just like too much for her body, you know? It's a lot on her. You know, she's been through a lot in her 12 years of life, and I don't want nothing to happen to her because all these, you know, she just can't recover like a normal, typical child. Say she's sick, you know, for a couple weeks, and then she's fine for months, you know. It's just like she gets it and then she's bam back in here again.
Alright. Well, I understand your frustration. Don't get me wrong. I don't think I have a solution. I want to tell you that. And I want to explain you why, and I can tell you what we can do about it. But I need to make sure that we're on the same page. I talked to the pediatrician, and I talked for a long time with Dr. Rich. We're talking about her for a really long time. It sounds to me that she has, these kidney stones that she has are very likely to be colonized with Pseudomonas, which is the bacteria that we grow in the urine. Because of her multiple antibiotic treatments, or maybe from the type of germ that she's colonized with, maybe more than a type, those organisms are not susceptible to the most common antibiotics. Now, Pseudomonas, as compared to other organisms, you can only treat it orally with one, perhaps two antibiotics. Everything else is IV.
Right.
and that means that I cannot or she cannot get prescribed a medicine at home just to take this at home,
Right.
right? So you need to understand that in order for her to receive antibiotics, it implies a hospitalization, which increases your level of frustration.
Mm.
But that's the way it is. Um, Patients that have stones are likely to continue to have bacteria in the urine. You won't be able to get those stones clear. You
Right.
won't. So I cannot guarantee that we can put on antibiotics and the infection will come back in 1 day, 1 week, 1 month, or 1 year. I don't know, but
Right.
I can guarantee that it will be back.
Right. I know. That's why we're here, unfortunately.
Dr. Rich explains me that the stones that she has cannot be removed. Cannot. Because her kidneys, fortunately, have not shown signs of increased dilatation of the urinary pathway coming into the kidneys. It's not dilated,
Right.
which is a good thing
Mm.
because you don't want it dilated.
Right.
But when it's dilated, it gives you room for you to move your tools.
Right.
And her, if he were to do the endoscopy as he did already, it's a very challenging case, and I get
Right.
that because you're dealing with tools that are still mechanical, and the tool cannot revert itself like 180 degrees and come back.
Right. I get that.
So he says, I may be able to get 1 or 2 or so, but I won't be able to get all those. And there might be some others that are like 1-2 millimeters, so we don't even see the ultrasound.
Mhm.
And even if you have one that is very tiny, like 2 or 3 millimeters, you can still get recurrent infections due to that.
Right.
Okay. So, however, if she's asymptomatic and she has, even though she has a positive urine culture, as long as she pees, she may be okay. The problem is that the moment that a stone will dislodge and will be blocked on the ureter, halfway from the kidney to the bladder,
Mhm.
if she gets obstruction and the urine is infected or the urine is colonized with the bacteria can rapidly grow and she can get sick.
Right.
Because she's going to have obstruction with urine that will be infected. That's a problem.
Right.
But if she's not obstructed, as long as she makes urine and the urine keeps going, everybody's happy.
Right.
That's why for me it's important to understand if she's getting sick or not. If she were able to express, you know what, I got flank pain, I have abdominal pain, I have fever, I feel nauseous, I have the chills, easy.
Right.
But she can't.
Right.
So you're telling me I know her because she's my daughter and I have her 12 years and I can tell she's not the same because the glossy of her eyes is gone. For me it's very challenging to attribute those symptoms to a urine infection. What if she had, I don't know, bad constipation? What if she's having more seizures? I don't know. But it really is a different management. But let's say that this is because she has a urine infection. And it looks like she did pass some stones, because some of the stones are in the bladder. Could be that she was having that when she passed the stone. Maybe, I don't know. How do I know? There's no way, there's no test, there's nothing I would know that would tell me. I can put her on an IV antibiotic. Let's say that I get a PICC line and I give her 3 weeks of meropenem antibiotics. That will treat the urine, will treat the pseudomonas that she has here. By the way, if she has still a lot of secretions, we have not been treating that because that germ in here was resistant.
Right.
Now, another concept, same thing. You generally don't clear up pseudomonas on the trachea. I told you that the last time. It's very common for patients to have it. Once in a while, if it gets out of control, you give a little bit of antibiotics and then it gets better.
Right.
But right now her X-ray it's not very clear that she has pneumonia, but the X-ray is a very difficult interpretation because it's not really like a X-ray that you take on the front. She's twisted in a way that the X-ray comes in a funny way, so I don't know if I'm looking at heart or lung.
Right.
So the it's very challenging. So
can they try to redo that?
yeah, we could do that. But if you tell me that
even
she
if I
still
have
has
to
a lot
help,
of,
I mean, I'll help. So it's
yeah,
not
but if you
really-
tell me that she still has a lot of secretions,
She
you know.
does. Very sick and
Yeah.
it's bad.
The other thing is, even if I put an IV, let's assume that I get an IV. Let's assume that I could send her home, and that she will get a home nurse that could at least help, you know, squaring all the IV antibiotics. I know you live far away too. Let's say that we get a nurse and we get lab services so she can get blood work like once a week at home. We could do that for 3 weeks with IV antibiotics. But you know, once again, what do I do when I stop the antibiotics and a week later her urine changes color? Or you go to see Dr. Montaner and says, oh, the urine changed. You gotta go to infectious disease. What am I gonna do? You see what I mean? So I need to be picky about what I treat and what I don't treat.
Right.
Because if the urine is smelly, but she's okay, I leave her at home alone with a smelly urine, and that's totally fine with me. But if she spikes fevers, or there's something clearly abnormal, I will be concerned that she's obstructed with infected urine, and that's a problem. That's a hospital problem. The other stuff, you know, you flip the channels at home.
You see, like all this is like when she's sick. This is what I'm talking about. You know, and it's just like all the time, and she doesn't stop. The only time she stops was when they give her medicine. When she wakes up, she's back to the same thing all over again, and she's been doing this since we've been here. It's horrible.
When you say medicine, what medicine you mean?
What do you call it? Danaflex, the muscle relaxers. But that doesn't fix the problem, because the problem's still here. You know what I mean? So no matter if she gets the medicine or she doesn't get it, she still acts like that. And that's concerning for me, because that, like I said, like when she does these movements, that's telling me that she's sick. You know what I mean? This is why we're here. You know, that's one kind of sign she tells me, lets me know when she's sick, is when she does those movements, the twitching in the face, and all that stuff, like she's doing now with her mouth and all that.
No, she's disconnected now?
No, she probably took it off.
She's supposed to be connected here?
Yeah, it's supposed to go on her tray. Yeah, let me see. What you doing? Yeah, that's what happened. The trach line thing.
Oh, okay. Let me get down that. Or let me have, Christine's doing it, right, Mom? Yeah, she's getting more sensitive. I feel like some piece is missing. I don't think that's the case.
There was nothing else on the floor. I don't know how they had that. She's been on it since we've been here, because her secretions are really thick and colored.
Wasn't she off of it when I had her a couple of days ago?
No, she
No?
she was on it.
Didn't they put the HME on the end? Maybe it didn't last very long.
Yeah, I think it lasts like an hour, and then we had to put her back on it.
She has a, I don't know honestly. This is a midline, I think. Mommy, what do they have her hooked up to?
I really have no idea how they had it, to be honest
There's not even the
Yeah, I don't know what.
piece isn't even
I
here.
just hear something going, like,
something
something
fall?
falling. Yeah,
Yeah,
we'll
because this
pick it
isn't,
up.
I need like the other piece.
I know, but I wouldn't put anything that fell.
I wouldn't
So-
see anything though.
Cause this is
I guess
just
just
suction, we don't need this.
or respiratory.
Cause this piece is missing.
Yeah. Let me put this on a glove.
So, at this point, if I want to treat anything, actually, the fact that she is
What is your thing about Missy?
uncomfortable or sick, if she's febrile, I wonder whether, she has like colicky pains, or, I'm not sure where is that discomfort. But in terms of the urine, I think that the urine right now is chronic, because she's been on antibiotics now for almost a week.
Right.
So, now I am worried about the ongoing secretions, and she do two resistant organisms. So I'm thinking about treating her for that. But as for the urine, I cannot, for the reasons that I explained to you, I think it's non-realistic, hoping that the problem will just go away, because it won't. So, either that, if she passed stones spontaneously since the time the doctor reached the surgery, we can hope that she continues to pass them more, and then being more selective as to what do we treat and what we don't treat, like I was telling you. Dr. Montana needs to be part of this discussion, and I don't know if she's on the same page as us. So, I'm not her primary doctor, but I'm gonna ask the team to perhaps, do some sort of like a family meeting, so we can all sit at a table and try to set like a treatment objectives, and for what things we act and how do we act, and what things we leave alone. Does it make sense? Maybe that at some point we might need to do surgery and then see what we can remove, and then crossing the fingers, because there are risks and benefits. And we just hope that the benefits will be better than the risks. It would be nice if this would be a stupid germ that we treated easily with oral antibiotics. We wouldn't be here, and nobody will be fussing. But the fact that particularly there are these kind of resistant bacteria makes things more difficult. There's some data, it's poor data in adults, that you can do stool transplant, like, putting healthy donor's poop into her intestine in an attempt to recolonize her gut with like a more silly bacteria, because she has seen a lot of antibiotics, so her intestine has different flora than mine, or perhaps yours, right? The bacteria she has is more limited in terms of repertoire, and probably more resistant than somebody else, but there's no really good data that I can push to do that. In the meantime, we could try to give her some probiotics in a lame attempt to kind of diversify her flora and make her, try to revert that antibiotic effect. So, I think that's what we should be aiming to.
Yeah, but there's
If
nothing
it
on
was
the
a
end of
single
it.
stone,
Yeah,
I
was it just the green
would
piece
just
or
say let's try to get it out. But she has many, and they're very up.
anymore. No, when I came in, that's what she was on. So they just literally hooked it in.
Okay.
Yeah.
So we're
And
gonna
then,
start.
then the MI gets
I
connected
want to
to
talk
that.
to the therapist, but respiratory therapist, but I'm thinking that I'm going to change many bodies, not because of the urine, but because I don't want to treat these kind of trichitis that she has.
Where long is that for?
Usually we do at least 7 days.
Okay, but I think they have that instead of the mask so that she can be connected to the MI. Yeah, but I already talked to her. She wasn't now.
And then, will be an issue of hoping that, with changing the urine, the alkalinization, and with the increased, fluid intake, hopefully she's going to have some more. Attention, you pass stones, you hurt until you pass it. Because they're in the kidney. They need to make the difficult descent from the kidney to the toilet, to the bowl, and they can get stuck problem. But that can happen anytime. All right. So let me talk to the therapist and to the pediatric team. Okay. All right.
Thank you.
I'm not sure if I was able to address your concern, but again, I'm not blind to your frustration. But you need to understand that it's not that we are bad people, that we are withholding the solution.
I know how to complicate it.
There's no solution that is like
Yeah.
boom, you know.
I'll probably
It's just a lot of navigating and hoping in this. Okay.
I understand what you're saying.
All right.
I really do.
Okay. Well, I appreciate it.
Yeah, that's fine.
I'll be here, and then next week Dr. John, my partner, who also knows, will be here. Okay. All right, very good. You're welcome. Take care.
I've had her previous admit, but this is my first time. Like, this admission is the first time. Yeah. Lots of yellow things. Do you want a demonstration, Nick?